There are many conditions that can be confused with ADHD, or they can be comorbid, in other words, present with ADHD, or could make ADHD symptoms worse. And these are all reasons why one needs to have a good medical history when you diagnose ADHD. There are medical reasons, there are developmental educational reasons, and there are also psychological reasons for children to present with symptoms that look or can be confused with ADHD. From a medical perspective, children with severe untreated allergies, and this includes all upper airway allergies as well as asthma and skin conditions, could present like ADHD because of their inability to concentrate or focus and be distracted because of their condition. But more so, children who do not sleep well. Any child with a sleep disorder, especially obstructive sleep disorders, children that snore, should be treated medically before the diagnosis of ADHD is made, because all of these conditions and the sleep deprivation could make children irritable, lack focus, and be distractible during the day. There is also an association with specific types of epilepsy, especially absences, which may be missed and be construed as ADHD, and if that is the concern, then an EEG also has to be done. Children with conditions that make them feel ill, like especially the uncontrolled diabetic patients, children with rheumatoid arthritis who have a lot of pain and discomfort, often may present as children who are not focused in class and not concentrating. They may, of course, also have sleep problems. Do not forget about children with autism. Many of them present with severe hyperactive behavior, especially when they are younger, and they can be missed, both the ADHD and the autism, and if we don't deal with both, of course, we are not going to be very successful. Children with low IQs can sometimes be very hyperactive, but it is the children with severe learning disabilities, children with marked dyslexia, that look like ADHD in the classroom. They cannot process language, their receptive language is poor, they do not understand instructions, they zone out in class because of language overload, and one of the major differentials for ADHD is severe learning disabilities. In the younger age group, sensory integration difficulties may present like ADHD, children who are very tactile defensive, children who are very sensitive to all sorts of sensory stimuli. These children need to have sensory integration therapy with an occupational therapist, and it is sometimes not a bad idea to include that in the therapy even in young children that present with ADHD in any case. Furthermore, the one psychological condition that can represent ADHD is anxiety disorders. Children with anxiety do not present the same as adults with anxiety. Children with anxiety have act-out behavior. They're aggressive, angry, they can't focus, they can't concentrate, they are distractible, and they can be extremely difficult. I always think that a child who had not had ADHD in an early age, who suddenly presents with ADHD-type symptoms in grade 6, the diagnosis is anxiety until proven otherwise. That is classically the year where children at school become anxious because they are not coping with the work, and that is often then linked to either a learning disability like dyslexia or severe bullying, which is a big issue in our schools these days.